Hello, my name's Ian McCall. This is a condition called acute haemorrhagic edema of infancy. Now, one of the things to notice, these red non-scaly plaques here, and this sort of bruising lesion around the base of the penis and involving the scrotum. It's just to enlarge this. Here you can see the bruising a bit better. Now, you'd get worried when you looked at something like this. This condition, acute haemorrhagic edema of childhood, is usually seen in children under the age of 2. But the thing is, they don't look unwell. You know, they don't have a fever, they're not ill or anything like that. Because sometimes when you see what look like hemorrhagic lesions, you get worried about meningococcemia. But a child with meningococcemia would have fever, headache, be unwell, as well as having hemorrhagic lesions like this. This condition has been recognized for some time. We still don't really know what the cause is. It sometimes follows an upper respiratory infection, but often there's nothing terribly interesting in terms of the child's health beforehand. The other name, by the way, for this condition is Finkelstein's disease. But there have been a variety of other little names, including purpura en cocarde from the French. There aren't many things will give you bruising and swelling of the scrotum like this. One other condition that can do it is called Henoch-Schönlein purpura. Now, Henoch-Schönlein purpura is a type of vasculitis, an inflammation of blood vessels. It's usually seen in children older than this. It is often associated with abdominal pain, sometimes with arthritis, and sometimes with renal problems as well. They may have a bit of blood in their kidneys. But children with this condition don't have any of those features at all. And in Henoch-Schönlein, if you do a biopsy, you'll find IgA positive immunofluorescence around the blood vessels. You don't get any of that in this condition. Though some people have felt that this is a sort of juvenile variant of Henoch-Schönlein purpura. Let me just show you a couple of other pictures to show how well the children with this actually are. Here's a child with this condition. Let me just make this a little bit bigger. Quite healthy child, suggestion of a slight squint. But look at these lesions. Look at the curious sharp edge to them, and they're purpuric. They don't blanch. You put your finger on these, you'll see that there's hemorrhage into the skin. But this was an exceedingly well child. And this was another lesion that this child had on the arm. Now if I just expand that up a bit for you, you can see why they call it en cocarde, in the shape of a hat. A darker central area with perhaps a little bit more hemorrhage and a lighter area around the outside. And there was also involvement of the upper arm in this as well. So, what else do we know about this? I've sort of mentioned here, whenever you see bruising in a 2-year-old, the other thing you might think of is, child abuse of some kind. But you could be very wrong with this one. So we've mentioned trauma, a bleeding disorder, perhaps a leukemia. You might think of that with bleeding into the skin, and meningococcemia. But of course, children would be much iller if there was any question of that. I said this child was well, afebrile, and running around. So it's seen only in children under 2. It's self-limiting. It will just disappear in 2 to 3 weeks. There's no long-term consequences. There's no renal problems as you may get in Henoch-Schönlein purpura. If you do a biopsy of this, it is a vasculitis, but it's purely confined to the skin. There's no involvement of vessels elsewhere in the body. So just be aware of this condition, acute haemorrhagic edema of childhood, and it's not something to get too concerned about. You certainly have to reassure the patients, and it doesn't need a whole variety of tests if you've otherwise got a well child and you recognize the sort of annular nature of these lesions. And I think it's best shown if I go back to the images of this young child here again, as to how characteristic these lesions are, even if you see them elsewhere in the body. So, acute haemorrhagic edema of childhood. Thanks very much.